What are you doing in my office?
The triplets. I want their case.
How do you even know about them? You don't even have access to the hospital's mainframe.
Well, I don't, but you do.
How did you get my password? You stole my password?
What counts as stealing?
No. I already assigned it to Dr. Prentice, who is way more qualified and an expert in cardiology.
Are you seriously the part-time pirate?
And you're a full-time pain addict.
I'll give you 2 more clinic hours. This week. Just this week.
So in this room we have a 60-year-old patient, a female, who has a extensive cardiac history for family-wise. Her family has CAD, which is heart failure, hypertension, hyperglycemia, as well as in terms of social history, she doesn't smoke, however she does socially drink. She is afebrile, mildly obese, and I think that's about it. Anything else?
Alcoholism? Severe?
No, just social.
Okay. Any kind of Parkinson's symptoms?
No, not at over. Oh, she complains she's just mild chest pain, but centralized.
Mm-hmm. Dr. House?
Show me your test results.
You have the x-ray? Fine.
Here's the CT.
And she has high blood glucose at 8.2, high blood cholesterol at 373, and high troponin levels 1.5 the last time you tested her. She's down for 2 more hours for the next test.
So aside from all the regular risk factors, do you do anything else like alcohol, drugs, cocaine, heroin?
I don't think that's any of your business.
So she's one of the 3 sisters. She's showing similar signs. We did take a look at her and she does show signs or symptoms of cardiomegaly.
Hello.
How's it going?
Good, how are you?
Pretty good. I want you to meet Dr. House. Do you mind explaining to Dr. House what happened on that day?
Well, I was playing basketball and then an orange just like hit my heart and ended up in the hospital.
Are you making this up?
No, I'm a truth teller. Oh, how are my sisters, by the way? Please fix our hearts because, you know, we're still young and I just want to get on with my life and pursue the American dream. So please help us. Oh my god, I think I'm having a heart attack.
No, you're not. You're fine. You're hooked up to a monitor. It would be obvious if something was wrong.
Dr. House, ultrasound shows liquid in the pericardium.
Can you like aspirate it?
No, I can't. You're fine. Pericardial effusion is usually not harmful, but can sometimes make your heart work poorly. The bigger concern is the endothelial vasoconstriction that you have. You know, everybody lies, so go find out what she's hiding, or what they're hiding, rather. Hey! Oh, wow. You got a big heart.
Yeah, I've had a history of atherosclerosis and hypertrophy. So I've been feeling, you know, chest pain, shortness of breath, fatigue, tingling in my arms, my extremities. Not good.
If anything, her results look a little troubling. She might need additional treatment, or else she will die.
Now, come on, look at heartbreaker. You'll be fine. I have something in mind. Alright, so what did you find?
Patient 2 is suffering from excess fluid in the pericardium. She also has cardiomegaly, so just a general case of cardiomyopathy.
Alright, so we're doing a cardiac revascularization and we're going to go for this procedure. So there's obviously inherent risk of that procedure. How do we reduce the chances that the patient's going to die?
I mean, there are 3 of them. We could sacrifice more.
Go ahead and do
The next 2, but let's explore some opportunities.
What about preconditioning?
Okay, I like that. How do we do this late preconditioning?
We can do it through
exercise, right?
Mm-hmm.
And what else?
We can have them put a blood pressure cuff on. And by the way, you spelled exercise wrong.
There.
That's still wrong.
Perfect.
It's close enough. The other one you said was what?
The blood pressure cuff.
Yeah.
Well, doesn't one of the patients have a fear of blood pressure cuffs for some unknown reason?
Yeah.
And exercise, well, we can't exercise them. I mean, there's a reason this patient has 5 metabolic conditions and a heart disease.
I mean, we can put them to sleep and then put the blood pressure cuff on.
That
They
is-
do have cardiac problems, so we can't really do that.
And that's also ridiculously illegal.
I read this study where they examined rats and basically they induce late preconditioning to TNF-alpha through a non-vascular, non-ischemic surgical procedure. That could work.
Have they done those on humans yet, or still within mouse trials?
But that's just minor detail. It's a mice. It's a rat study.
They're 2 different species.
It's close enough.
By 85% on average.
Some genes are 90% similar between, or 99% similar between humans and mice.
And some are 65%.
These are the options. I mean, there are 3 of them. One dies, we can review. So in essence, this paper is pretty interesting because it suggests that TNF-alpha can signal both upstream and downstream. And also it is unique from any other preconditioning methods because it is non-vascular and non-ischemic in nature, whereas all the other, i.e. exercise and their blood flow restriction, is either ischemic or vascular. Yet, this abdominal incision, right, which lends this protection to the TNF-alpha, has been shown to be useful, in rats anyways, in mitigating, in case of any kind of ischemia, the effect of that ischemia, and also increasing the survival chances of our subjects. So, I think this is our best option. Wouldn't you agree?
I agree.
Yes, so.
Anything to add?
Well, we have to.
Alright, let's test it.
Starting now.
The triplets. I want their case. You actually got this? Beautiful. That is hard to cancel.
No.
Okay, I give you time to cut now. I forgot that one. Hard to cancel. Ready? See these results.
Yes, we have the x-ray. What do you think? Dr. House, ultrasound shows
Oh my god, I think I'm having a heart attack.
by the way, you spelled exercise wrong. Closed marker, man.
Hopefully it goes up. Go forth and cut them open.
You did not take a class in stethoscope. We should have brought a stethoscope.
Alright.
It's okay, I can Photoshop.
Okay, you're dying.
Wait,
So-
I mean, what's
She's gonna die in 9
You need
minutes.
yours, mine's like, okay, wait.
Yes.
You'll be fine. Okay, wait, what's the
No,
I got all last
guys did me.
Pretend you're on a boat. Faster. Slow down. Turn left.
This is the filling.
Yeah.